Doing a video on how to start an IV. First, we're going to start by verifying the physician's orders for the IV therapy. Next step would be to assess the client's previous or perceived experience with IV therapy and arm placement preference. You'll ask them, have you ever had an IV before? Where did they usually get you? Blah, blah, blah. Okay, the next step is to gather all your appropriate equipment. Alcohol swabs. We're going to prime the tubing, maintaining sterility. Priming the line and making sure there are no bubbles, we need to provide explanation to the client. Apply the tourniquet 6 to 4 inches above the intended access site. And appropriately select the vein. Avoid areas that are painful to palpation. Select the site that will not interfere with ADLs. Avoid site distal to previous site, bruised area, or infiltrated sites. Palpate the vein for resiliency, softness, fullness, and spongy feeling. Once you found the vein, you can release the tourniquet temporarily. Tie tourniquet safely. Cleanse the insertion site. Stabilize vein by pulling skin taut in opposite direction of the venipuncture. Explain the client will feel a quick, sharp stick. Puncture the skin using a direct or indirect approach. Hold catheter at 30 or 45-degree angle. Observe for a flashback of blood. Lower the catheter and slowly advance additional 1/8 to 1/4 of an inch. Release the tourniquet. Catheter is fully advanced. Apply pressure 1 to 1 1/4 inch above insertion site and remove stylet. Connect IV tubing primed with fluid. Connect IV tubing primed with fluid. Secure the IV catheter and dress the site appropriately. Be sure to date, time, and initial your dressing and tubing. Instruct client on how to protect site and avoid dislodging catheter. Dispose of any uncapped needles. Explain signs and symptoms of infiltration or phlebitis. and document procedure appropriately.
Sometimes they give it, even the hospital will give it to us when I didn't need it for expired.
Make sure to dispose of uncapped needles or stylet gloves and all equipment appropriately. And that's it. Thanks for watching. Please subscribe.